Welcome to Conversations. I'm your host, Emily Rains. Thank you for spending some time with us this weekend. Joining me this segment is Dr. Megan Beers. She's the Chief Program and Operations Officer at Childhaven. Join us as we look at issues that affect us here at home, in our community, and across the nation. Childhood trauma and adversity are the root cause of the most urgent and costly programs that plague our children, families, and communities. And Childhaven has been dealing with these issues for a very long time. But because it is Mental Health Awareness Month, I wanted to focus on what Childhaven does for kids' mental health because it is extremely important. Dr. Beers, thank you so much for joining us this morning.
Thank you for having me. Delightful to be here.
I've heard about Childhaven through multiple people, but for those who haven't, tell us about Childhaven.
Absolutely. Well, Childhaven is one of the oldest nonprofits serving kids and families in our community, so we've been around a long time, but we're evolving and growing in exciting ways. So at the core of what we do is really serving kids and families, and particularly a lot of young children in the birth all the way up through 5 years old space who are experiencing trauma and adversity and a lot of chronic stress in their lives, and supporting them through a variety of different services and supports and bolstering kind of the relationships in their lives to help them on their path to healing.
And you said Childhaven has been around forever. How did it get started?
Yeah, super interesting. We actually started over 100 years ago, kind of in the what we would now think of as kind of the childcare space. So it was a place for little ones to go and be cared for during the day when their moms were out of the home working at the time, and really kind of evolved from there over the years.
So, what are some specific services you offer to these kids?
Yeah, well, I think we've been on a pretty exciting path in the last few years. So we've gone from really kind of doing one core thing to doing a lot of different things, a lot of different services and supports. So we actually have 14 different ways, 14 different service lines. But at the core, a lot of what we're doing is really working together with parents and their kiddos, often out in the community. So we do a lot of visiting folks in their homes, going to their childcare or school environments, and really supporting the grown-ups in kids' lives with kind of the skills and strategies to support kids when they're going through really, really stressful things, big things that are hard for little ones to navigate.
So this is not my kid's acting up, I don't know why. This is we've gone through a trauma, I know my kid needs some help.
Yeah, absolutely. And I guess, one of the interesting ways we've evolved, and certainly this year, we all know this, right? Like some of the trauma that we're responding to is not only like individual things that a child has experienced, but what's kind of happening in the community around folks, right? Right now we know kids' mental health is kids and adult mental health, but challenges are on the rise. And so sometimes it may be kind of one big bad thing, one specific trauma that happened, but it also may just be kind of the chronic stress and adversity that comes from food insecurity or transitions in housing, things like that create stress for families.
When you say services, do you mean therapy, like talk therapy, or is it, hey, let's, if they have food insecurities, let's get them with a nutritionist, that sort of thing?
Yeah, that's a super interesting question. I mean, one of the ways we've evolved, so we absolutely do have mental health therapists on our team who are trained in therapeutic approaches to work with kids and families. But we've really kind of diversified and broadened out. So we will, if a family is coming to us and maybe they need that kind of support, the family's been through a traumatic experience, they need mental health therapy, but they also need some support around housing, right, to be able to really engage in that mental health therapy, or they need some support around kind of getting other basic needs met, that we will absolutely have that as part of our ecosystem of support to navigate those things as well. We also have other kind of specialists. So, for example, speech therapists, occupational therapists, folks that can work more on developmental skills with kids and families. So really kind of a pretty broad range of when little kids are struggling, kind of a range of things that we can offer depending on what the specific family needs and working with them to kind of find the right fit of service.
Do you also offer group sessions for the parents?
We do. Yes, we do. And I think that's it's probably one of the the biggest misunderstandings about our work is, I think when people hear Childhaven, they're often thinking of kind of what's individually happening with kids, but actually a lot of our work is with parents. So we have different settings where parents come together to share their experiences and learn from one another, as well as more individual one-on-one work with parents. But so much of supporting kids is working through the important grown-ups in their lives. So a lot of it's actually more family and community focused as well.
Where are you guys located?
So we are, it's been an interesting year for sure. Mm-hmm. Much of the year we've been a lot of our services have been remote, but we really cross all of King County at this point. So we have a location on First Hill in downtown Seattle, but then we have 4 locations throughout South King County. So we cover Renton and Auburn, Burien. So really serving kids at this point all throughout the county. And, because much of our work is in homes, in schools, kind of in different settings, those locations in some ways are kind of a home base, and then folks are providing support to families all over the place for sure. And
is this support free to those that need it?
It really ranges. So everything we're doing is no cost to the families themselves, and ranges different programs. We accept insurance or different things like that, or they're just funded through contributions from folks in the community, investors, as well as through other grant making. So none of the services we're providing at this point. You can come to us, and we figure out the back end. We figure out how the service is paid for, and the family hopefully gets what they need without worry about the financial investment.
And what's the best way for someone to get help from you all? Is it to call, to visit, to go to the website?
Yeah, so childhaven.org is our website. And, it's really, really a good way to start is by going to the website. We have our referral line there, but you can also submit information just right on the website, and someone will give you a call if that's more straightforward. And one of the things that we really just encourage folks to do is give us a call if you've got, if you've got a concern about your child, if you've got a concern, or like a family that you're close to and you're thinking about how to give them support. Don't worry about which service is appropriate. Don't worry about, are they eligible? Are they not? Just give us a call and we'll help you navigate all that. And so really just encourage folks to reach out, and the website's a great place to start.
Well, and on the flip side, for those listening that maybe don't have a child or don't need your support but would like to help Childhaven, obviously you guys accept donations, correct?
We do. We definitely do. We have big chunks of our work that are driven by investment from folks in the community. So absolutely welcome support in that way. And then also just welcoming, I think welcoming support of folks kind of spreading the word about the work we do. Being an ambassador for Childhaven is really hugely valuable. I think, folks don't often think of mental health and very young kids. So the more we get people talking about this in our community and get folks little ones into service early on, kind of the better we're all, the better off we all are as a community. So just really encouraging folks to spread the word, as well as, of course, financial contributions are incredibly valuable as well.
Do you accept tangible donations like toys or clothes or, sanitary kits or whatever it may be?
We do at various in various ways and various times, kind of specific to what the needs are. So we always have updated info on our website if we're doing a particular drive or kind of what the particular need is. So we don't kind of have a broad acceptance, but we'll have info at all times about kind of if there's things that the organization could benefit from and those that we serve could benefit from.
And then if someone can't financially contribute but would like to donate their time, do you guys have volunteers? And what are some of the specific volunteers or things that people could do as a volunteer?
Yeah, that's evolved a lot right now. So currently, we're certainly have volunteer opportunities for folks. Historically, there's been more opportunity kind of prior to the pandemic, more opportunity for folks to engage in classrooms and kind of have more kind of direct interaction with kids and families in their volunteer work. Right now, because of limitations around the pandemic and the way things have evolved, that's not an opportunity, but we certainly have folks that engage in a volunteer capacity around supporting that work in a variety of different ways, and ways that you can do from home, or providing support on one of our sites, kind of prepping materials, et cetera, like that. So certainly welcome folks to reach out for that as well.
And if someone says, I get it, like, hey, I'm a soccer coach and I'd love to come in and, teach soccer or play with kids or whatever. I know you can't do that now. Should I go ahead and reach out now and get on your basically waiting list to volunteer, or should I just wait, hold off, and then when things clear up, reach out to you guys?
We'd love to have folks reach out now. Things are changing all the time. We'd love to just find ways to engage, kind of whatever your interests are. So, encourage you to reach out. Can tell you a little bit more about what we do, learn about your interests, and kind of go from there in the conversation. So, always trying to broaden the number of ambassadors we have in the community, and hear kind of how we can work together to address the needs of the families we serve.
And Dr. Beers, I ask this of everyone that I talk to. Is there anything we haven't covered that you want our listeners to know?
I guess, the piece for me is just kind of a recognition of, and this feels more true, and given what we've all experienced in the pandemic in the last 18 months, I think it's just an acknowledgement of the number of kiddos and families that are experiencing trauma in our community. I think folks often think that it's pretty rare. In actuality, the data would suggest that at least a third of the kids and families in our community experience something of really significant impact, and that has a huge impact on their lifelong health and well-being, particularly when it happens in the early years. So just really, really encourage folks to engage and think about. I think folks often don't think that, the Childhaven's work might be connected, for example, to homelessness. It's connected to adult mental health. It's connected to things that happen down the road in the lifespan. So encourage folks to learn more and reach out and connect.
Well, Dr. Beers, thank you so much for joining us. My boyfriend has volunteered with you guys before. That's why I mentioned soccer, because he did the Little Kickers program, and he just
wonderful.
raves about you guys. When I said I was talking to you, he was like, "Oh my gosh, tell him I said hi." So
that's amazing.
Yes,
love to hear that. Very cool.
Well, thank you again, and just for what you guys do and the support you offer to our kids, because I know it's Mental Health Awareness Month, and so we definitely wanted to focus on kids need help just as much as the adults.
Absolutely. Well, thank you for taking the time, and really, grateful for the opportunity to share.
Of course. And thank you for listening. Conversations is a public affairs program of this station.